complexities of being young.
A new report commissioned by the chief coroner takes aim at a somber statistic. Despite efforts to educate and help, the rate of death by suicide in BC amongst youth and young adults hasn't changed in the past 5 years. 435 people aged 9 to 25 died by suicide between 2019 and 2023.
The number of young lives lost to suicide in BC has remained relatively unchanged over the last several years. Little progress has been made in terms of understanding, recognizing, and reducing risk.
The coroner's death review panel sets out 5 recommendations for addressing the tragic trend that actually saw deaths by suicide increase compared to the preceding 5 years. The top recommendation, creating a province-wide suicide risk reduction framework focused on youth and young adults.
Province-wide approach will help ensure positive outcomes that meet the unique needs of youth and young adults across the mental health spectrum.
Other recommendations include creating an educational model for healthcare professionals to identify warning signs and improving data collection, information sharing, and reporting processes to better understand and support diverse communities. The report's authors found Indigenous communities were disproportionately impacted, a tragic reality for the family of 16-year-old Felicity, who died by suicide in 2023. Her family seeking answers from a system it says let her down.
Every child is supposed to matter, and I just feel like that she didn't to them.
The health minister says the province is reviewing all the recommendations. With suicide the second most prevalent cause of death among children and youth in BC and third most common among young adults, the death panel hopes that review turns quickly to action.
Rob joins us live from Victoria. Rob, what other recommendations were made today to try to reverse this gut-wrenching situation?
Well, Mi Jung actually spoke today to Carol Todd, Amanda Todd's mother. Of course, that situation that was so tragic and generated international attention when the 15-year-old 13 years ago this past Friday died by suicide after being bullied online. She talked about some practical ideas she had, including the fact that there is still, in her view, a big stigma associated with mental health that children need, to help getting beyond. She also talked about the fact that during the wee hours of the night, there is a significant amount of suicidal ideation during those bleak hours, and it would be important and valuable to have in-person counseling available at that hour rather than simply crisis lines. So while it's been 13 years that she's been touched and there has been improvement, there is still a lot of work. And the review panel today hoping that their recommendations don't just stay such as that, but turn to action. Mi Jung.
Hopefully we will see some improvement. Thank you, Rob.